Have you ever woken up with your mouth feeling so dry? It's as if every bit of moisture just disappeared overnight, even though you drank water before going to bed. You take a few quick sips, maybe rinse your mouth, and then move on with your day, like it's nothing. But here's the thing, it's not just you. Millions of people experience this every single morning, and almost all of them assume it's completely normal. The truth is, that small habit of brushing it off could be causing you to ignore an important signal your body is trying to send. A signal that, if understood early, could reveal underlying health issues you didn't even realize were developing. My name is Dr. Michael Harris, and in this video I'm going to walk you through what your body is really trying to tell you when you wake up with a dry mouth. We're going to break down the science in a way that actually makes sense, uncover the hidden causes that most people never think about, and more importantly, I'm going to show you exactly what you can do starting tonight to fix it. Because here's what most people get wrong. They think dry mouth is the problem. It's not. Dry mouth is the message. And once you understand what that message means, you can take control of your health in a way that most people never do. So stay with me until the end, because one of the causes I'm going to share later is something that many people have right now without knowing it, and catching it early could make a serious difference in your long-term health. Before we jump into the specific causes, you need to understand one important thing. Dry mouth itself is not the real problem. It is a signal. Your body is designed to produce saliva continuously, even while you sleep. Saliva is not just there to keep your mouth comfortable. It plays a critical role in protecting your teeth, balancing bacteria, and starting the digestion process. It keeps your oral environment stable and healthy without you even thinking about it. So when you wake up and your mouth feels unusually dry, what you are experiencing is not just a lack of water. It is a disruption in a system that is supposed to be running quietly in the background all night. And that brings us to the first cause that most people never expect: stress and anxiety. You might be thinking, what does stress have to do with a dry mouth in the morning? The answer lies in how your nervous system works. When your body is under stress, it activates what is known as the fight-or-flight response. This is a survival mechanism that prepares you to react to danger. Your heart rate increases, your breathing becomes shallow, and your body redirects energy toward essential systems needed for immediate action. And one of the first things your body reduces during this state is saliva production. Now imagine going to bed with a mind that is still racing. You are thinking about work, finances, responsibilities, or unresolved problems. Even though your body is physically lying down, your nervous system is still in a heightened state. That means your body never fully shifts into a deep, restorative mode during sleep. Your saliva production stays suppressed. Your breathing may become irregular, and by the time you wake up, your mouth feels dry and uncomfortable. But it does not stop there. Chronic stress does more than just dry out your mouth. It disrupts your sleep quality, weakens your immune system, and increases inflammation throughout your body. Over time, this creates a chain reaction that affects your overall health in ways you may not immediately notice. So what can you do about it? Start simple. Give your body a clear signal that it is safe to relax before you go to sleep. This could be as basic as turning off screens 30 minutes before bed, taking slow deep breaths, or writing down your thoughts to clear your mind. Because sometimes fixing your dry mouth is not about your mouth at all. It is about calming the system that controls it. Now let us move to the next cause, and this one is incredibly common. Mouth breathing during sleep. If you are breathing through your mouth, while you sleep, your mouth will dry out. It is that simple. Air constantly flowing in and out pulls moisture away from your oral tissues, and over several hours, that moisture loss builds up. By the time you wake up, your mouth can feel dry, sticky, and uncomfortable. But here is the real question. Why are you breathing through your mouth in the first place? For some people, it is due to nasal congestion. Allergies, a blocked nose, or even the structure of your nasal passages can make it harder to breathe through your nose, especially at night. So your body naturally switches to mouth breathing to get enough air. For others, it becomes a habit over time. You may not even realize you are doing it. The problem is mouth breathing does not just cause dry mouth. It can also affect your sleep quality, increase snoring, and even impact your overall oxygen intake during the night. So what can you do? Start by making sure your nasal passages are clear before you go to bed. Simple steps like rinsing your nose with saline or keeping your sleeping environment clean can make a big difference. You can also train yourself to be more aware of your breathing patterns during the day, which often carries over into your sleep. Now let us move to another cause that many people overlook completely: medication side effects. If you are taking any kind of medication, there is a very high chance that dry mouth is listed as a side effect. This includes medications for blood pressure, allergies, depression, anxiety, and even common over-the-counter drugs. These medications can interfere with the signals that control saliva production or reduce the activity of your salivary glands directly. And the tricky part is this: many people start a medication and do not connect it to the new symptoms they are experiencing. They assume the dry mouth is unrelated, or they simply ignore it. But over time, reduced saliva can lead to more serious issues like tooth decay, gum problems, and discomfort when eating or speaking. Now, this does not mean you should stop taking your medication. That can be dangerous. What you should do instead is be aware. If you notice that your dry mouth started or worsened after beginning a new medication, talk to your doctor or pharmacist. There may be alternatives available or simple strategies that can help reduce the side effects without affecting your treatment. Because sometimes the solution is not about adding something new. It is about adjusting what you are already using. Now let us talk about something that sounds simple on the surface, but is often misunderstood: chronic dehydration. Most people believe they are drinking enough water. But the reality is, many people go through their entire day in a mildly dehydrated state without even realizing it. You might drink coffee in the morning, maybe another cup in the afternoon, and then wonder why you feel thirsty later in the day. What many people do not realize is that drinks like coffee and alcohol can actually cause your body to lose more water than it takes in. Add to that a busy lifestyle, long hours, and not paying attention to hydration, and you could easily go to bed already dehydrated. Now combine that with a dry sleeping environment. Air conditioning heaters or low humidity can slowly pull moisture from your body throughout the night. By the time morning comes, your body is simply reflecting what has been happening for hours. So what is the solution? It is not about drinking a large amount of water right before bed. That will only disrupt your sleep. Instead, focus on staying consistently hydrated throughout the day. Spread your water intake evenly, reduce caffeine later in the day, and consider using a humidifier in your bedroom to maintain a comfortable level of moisture in the air. Now, the next cause is something far more serious, and this is where you need to pay close attention: sleep apnea. This is one of the most underdiagnosed conditions today, and many people who have it do not even know it. Sleep apnea occurs when your airway becomes partially or completely blocked while you are sleeping. When this happens, your body struggles to get enough oxygen. In response, It forces you to breathe through your mouth or briefly wakes you up to reopen the airway. This cycle can repeat dozens, sometimes even hundreds of times in a single night. And here is the part that most people miss. You may not remember waking up at all, but your body does. People with sleep apnea often snore, loudly feel exhausted, even after a full night of sleep, wake up with headaches, and yes, experience severe dry mouth in the morning. Because all night long, your body has been fighting just to breathe. Over time, this puts enormous stress on your cardiovascular system. Your blood pressure rises, your heart works harder, and your risk of serious conditions like heart disease and stroke increases significantly. I once worked with a patient who thought he was sleeping just fine. He slept 7 to 8 hours every night, but he always woke up tired and complained about dry mouth. It turned out that his oxygen levels were dropping repeatedly throughout the night due to undiagnosed sleep apnea. Once he received proper treatment, everything changed. His energy improved, his sleep became deeper, and the dry mouth that he had ignored for years completely disappeared. So if you wake up with dry mouth along with snoring fatigue or headaches, this is not something to ignore. Getting evaluated for sleep apnea could be one of the most important decisions you make for your health. Now let us move into another cause that many people never connect to dry mouth, even though it plays a significant role: acid reflux. This condition occurs when stomach acid travels back up into your esophagus while you are lying down. And in some cases, it can reach as high as your throat or even your mouth during sleep. When this happens, your body reacts in different ways. For some people, it creates a sour or bitter taste in the morning. For others, it irritates the tissues in the throat and mouth, leading to a dry and uncomfortable sensation when they wake up. You might also notice symptoms like a burning feeling in your chest, a chronic cough at night, or a sensation of something stuck in your throat. Now, here is where it becomes important. If this is happening regularly, it means your body is dealing with repeated irritation night after night. And over time, this can affect not just your comfort, but your overall digestive and respiratory health. So what can you do? Start by avoiding heavy meals close to bedtime. Give your body at least 2 to 3 hours to digest before lying down. Elevating your head slightly while sleeping can also help prevent acid from moving upward. And reducing trigger foods like spicy dishes, caffeine, chocolate, and alcohol can make a noticeable difference. Now, let us talk about another cause that is even more serious, especially because it often develops quietly: blood sugar imbalance, including prediabetes and type 2 diabetes. When your blood sugar levels are consistently elevated, your body tries to remove the excess sugar through urine. This process pulls water out of your system, leading to dehydration. And one of the earliest signs of that dehydration is a dry mouth. But it does not stop there. You may also find yourself waking up multiple times during the night to use the bathroom. You might feel unusually thirsty during the day, experience fatigue, or notice changes in your vision or sensation in your hands and feet. The challenge is that these symptoms often develop gradually. Many people live with them for years without realizing what is actually happening inside their body. That is why this matters so much. Catching blood sugar issues early gives you the opportunity to make changes before serious complications develop. With the right adjustments in diet, physical activity, and medical guidance when needed, it is possible to bring your levels back into a healthier range. So, if your dry mouth is accompanied by increased thirst or frequent urination, do not ignore it. It could be your body's early warning system telling you that something deeper needs attention. Now, let us move into a cause that is less common but extremely important to recognize, especially if your symptoms do not improve over time. Autoimmune conditions, specifically something known as Sjogren's syndrome. This is a condition where your immune system mistakenly attacks the glands responsible for producing moisture in your body, especially your salivary glands and tear glands. As a result, your body physically cannot produce enough saliva no matter how much water you drink. So if you find yourself constantly dealing with dry mouth, not just in the morning, but throughout the day, and especially if you also experience dry eyes, fatigue, or joint discomfort, this is something you should not ignore. Because unlike other causes, this is not just about habits or environment. It is a medical condition that requires proper diagnosis and management. The challenge is that many people dismiss these symptoms as part of aging or stress, and they go years without getting checked. But early detection can make a significant difference in managing symptoms and preventing complications like severe dental issues or chronic discomfort. So if your dry mouth feels persistent and does not respond to basic changes, it may be time to look deeper and speak with a healthcare professional. Now let us move to the final cause, and this is something that affects almost everyone to some degree: your oral health habits and your sleeping environment. When your mouth becomes dry, it creates the perfect environment for harmful bacteria to grow. Saliva normally helps wash away food particles, balance bacteria, and protect your teeth and gums. Without enough saliva, that protection weakens. Over time, this can lead to bad breath, tooth decay, gum disease, and even infections. And here is where many people make it worse without realizing it. Using alcohol-based mouthwash, for example, can dry out your mouth even further. Not cleaning your teeth properly before bed leaves bacteria active all night. And sleeping in a room with very dry air can intensify the problem. So what can you do? Start with the basics, but be consistent. Brush your teeth thoroughly before bed floss daily, and consider using an alcohol-free mouthwash. You can also use products designed to keep your mouth moisturized overnight if needed. And do not underestimate your environment. Keeping your bedroom at a comfortable humidity level can make a noticeable difference in how your mouth feels when you wake up. Because sometimes small changes in your daily routine can have a powerful impact on your overall health. So here is what I want you to take away from everything we have talked about today. Waking up with a dry mouth is not just a random inconvenience. It is not something your body does without a reason. It is a signal. And as you have seen, that signal can come from many different sources. Sometimes it is something simple, like dehydration or your sleeping environment. But other times, it can be your body pointing towards something deeper, like stress, blood sugar imbalance, or even sleep apnea. Now let me share something from my own experience. Over the years, I have seen many people ignore small symptoms like this because they seem harmless. And in many cases, they are harmless. But in some cases, those small signals were the very first clues of a much bigger issue developing underneath. And what I have learned is this: the people who stay healthier over time are not the ones who never have symptoms. They are the ones who pay attention early, ask questions, and take action before things become serious. That is the mindset I want you to have. At the same time, it is important for you to understand this clearly. This video is not meant to diagnose or replace professional medical advice. Everyone's body is different, and if you are experiencing persistent or worsening symptoms, the safest and most responsible step is to speak with a qualified healthcare provider who can evaluate your specific situation. But what you can do starting today is become more aware. Pay attention to patterns. Notice what your body is telling you. And do not automatically dismiss something just because it feels common. Because common does not always mean normal. Now, I would really like to hear from you. Do you wake up with a dry mouth in the morning? And after everything we discussed, what do you think might be causing it in your case? Leave a comment below and share your experience. You might help someone else connect the dots in their own life. If you found this helpful, take a moment to share this video with someone you care about. It could be a small action that leads to a meaningful change. And if you want more content, like this simple explanations that help you understand what your body is really trying to say, make sure you subscribe and turn on notifications so you do not miss the next video. This is Dr. Michael Harris reminding you that your health is something you build through awareness, not by accident. Take care of yourself.